This is part two of where I identify gaps in the COVID literature. This one is focused on vaccination, time to vaccination after a COVID infection, the quote unquote safety window or recommended time period after the end of a COVID infection to getting vaccinated, being able to get vaccinated with a COVID vaccine that hasn't been fleshed out and defined. And there are a few parts to this potential issue. The first can be broken into two parts. The first one is that for people that have a recent COVID infection that get vaccinated, they seem to have a higher propensity of developing long COVID following vaccination. And that's something that needs to be investigated. And the second one is for people that had a recent COVID infection, getting the COVID vaccine very close to the infection seems to trigger a higher level of symptoms or a reemergence of symptoms if they had just went away. And three, as we know that COVID sort of damages our immune system, depletes the T and B cell count levels within our body and the ability of our bone marrow to produce more of these. The issue is at what point following infection has our immune system recovered enough to generate a sufficient neutralizing antibody response to the COVID vaccine. So those are the three questions that need further investigation to ultimately provide a safety window for a general time range after infection when it would be okay to get vaccinated. So this could be a retrospective analysis where you're going through medical data and you would have to figure out exact times from PCR um, stated things to reaching into the medical history with approval of the patients to be able to get their vaccination records to see how long after infection did they wait to get vaccinated and what were the complications, if any, that occurred. This could also be a cohort study where you enroll different institutions and track between certain date ranges over the course of a year or 2 years. And you figure out, okay, so based off of our previous retrospective analysis that we did as preliminary research and our current cohort study, this is what we found. Ideally, in this cohort study, you would be sampling initial antibody levels prior to a COVID infection, the antibody levels after the COVID infection, and your T cell, B cell counts, and maybe some other things like neutrophil level, platelet activation time, and then repeating those measures again after the COVID infection, repeating them at various intervals after the COVID infection, maybe like immediately after, uh, then 1 month, 3 months, 6 months, a year, at shorter intervals if you want a more precise time period to see what's happening from just a COVID infection and then how long it takes to recover. So that would be the control group. And then you would have people that had the COVID infection. You're tracking these same things across time points, and then they're getting vaccinated at various intervals after that, and you're figuring out what's happening after those vaccinations and essentially how long after that infection are you generating an appropriate immune response with a high level of neutralizing antibodies um, from the vaccination itself. Because the worries are if you're too close to infection and you get vaccinated, will you generate an appropriate immune response? Uh, are you going to have complications? Is this going to trigger long COVID? Or at the very least, a re exacerbation of some symptoms that had previously dissipated, with the general theory to why this is happening being that COVID has viral persistence, meaning that it's still going to survive either in reservoirs and things like your GI tract, or it's going to just be sort of free floating still in your body, like in your bloodstream. Maybe it has blood that has sort of coagulated around it, with the essence of it just being that COVID is still present within your body. So when you're getting that vaccination, you're stimulating the immune system to COVID. And since your immune system is now checking for COVID everywhere and it's finding that it's present, it's sort of a reactivation of the immune response, sort of sending your immune system into overdrive and causing more inflammatory responses. And that's where this mechanism of theory comes from.